I'm Dr. Raynald Torres, cosmetic plastic surgeon of Enhancements Cosmetic Surgery. I'm here to talk about liposuction. Liposuction surgery is a surgical procedure used to sculpt or shape the area of a body or your face. The procedure is done with special instruments used to suck out the fat in certain areas, and that also allows the surgeon not just to remove fat but also contour that area, bringing out some curves of the body that have been obscured when one deposits fat in that area. The amount of fat that is usually removed in one session is I usually limit that amount around 3 to 4 liters. One, because the body would easily adapt to the amount of tissues that would be removed in one session, and this gives the patient the option to go home right after the surgery. The best candidates for liposuction are those that require some trimming or some contouring of certain areas of their body because of some fat deposition. A big number of them are those who had previous pregnancies and could not remove their retained fat by simple diet and exercise. Some patients, they accumulated a little fat or some fat in certain areas like their belly, their arms, under the neck, on their thighs. This can be true especially among women who just gave birth. Sagging of the skin after removal of fat can happen, but of course you have to evaluate. The skin is an organ that is alive and it has its elasticity, so it contours to whatever structure is underneath that. So if you remove some fat, the skin contracts and shapes to a smaller figure. This is true with patients who have very elastic skin. However, there are some patients that have non-elastic skin, or those that have stretched to their limit. For example, if you have a garter and you stretch it, and stretches back, it contracts back, but you stretch that garter to a limit and then you can see that it bacons up. This is same as the skin that has been stretched to its limits. Surgery time depends on how many areas and how much fat will be removed, and this ranges from 1 hour to 4 to 5 hours. I have a follow-up on the next day of surgery to change the dressings, and another one after a week for removal of the suture.